Hello and welcome to Network. My name is Pumelele Zonde with your social media and technology news. Welcome to 2021 and we hope you are safe where you are and adhering to all those lockdown conditions. This week we are going to look at 2020 in review. You can send us emails on newsnetwork@sabc.co.za. On Twitter, we are on SABC Network. You can also find us there on Instagram and Facebook as well. And let us know about some of the technology that impressed you or disappointed you in 2020 and what you are looking forward to in the sector in 2021. Well, 2020 was an unusual year as the whole world was dealing with COVID-19. Things in South Africa suddenly shut down in March and most things moved online, including education. University students found themselves in a space they've never been before, and many struggled to do their learning online. We went to Ndabayake in the rural areas of KwaZulu-Natal and found out what their challenges were there. When we first met Sphelele Nzuza, he was in his rural village of Ndabayake near Empangeni on the KwaZulu-Natal north coast. University had just been abruptly shut down before South Africa's COVID-19 lockdown. He had issues with internet costs and constant power cuts, blocking him from doing his university work.
Ugesi asinawo uyahamba ugesi njengoba kuyi-lockdown nje thina sisenkingeni asiqhubeki ney'fundo zethu ama-laptop awana-battery cisha ngisho amafoni.
When the Durban University of Technology said third year and fourth year students could return to campus, he quickly packed things and returned to the city.
Not all of us as in our phones are right, so some of us couldn't log go GT library because of us having some phone advanced ngendlela efanayo.
University of KwaZulu-Natal postgraduate student Nonduduzo Kumete also rushed back to campus.
At some point, my data had to be cut because of the zone that my area is in, and there was not much connectivity. It was called the Telkom Roma area, so they couldn't distribute into such areas. So I ended up not being able to get data for like a month or two. So I had to come back to the institution to be able to continue with my studies.
We meet Snentlantla Mazibuko. The first-year Wits University student hadn't been in Johannesburg for a long time when he was told he too had to pack for home. He had not used a computer at home in Loskop and definitely not as the primary tool for his education before level 5 of South Africa's lockdown.
Our lecturers bayakwazi ukuthi basithumelele ama-MP4 videos la akwazi ukuthi bachaza khona ama-notes and they send out ama-notes, ama-PDFs la ukwazi ukuthi ufunde khona and you can take ama-quizzes and ama-tutorials just to practice for ama-tests ozowenza futhi now online. We have like a community library, so they have ama-computers la sikwazi ukuthi senze khona, but really you have to use it for the whole community, so you can't spend a lot of time ukuthi usebenzise yona. So when I got to Joburg, where like konke nje technology and stuff, so I had to adapt to that stage ukuthi nami kufanele ngikwazi ukufundisa, and it took me time to get used to it.
Educationist and app developer Mfundo Dzanibe says a lot needs to be done to solve the digital divide and exposure in higher education.
In the rural areas, we still don't have the network that is required or the quality of the network that is required. So we have to think about how do we get the network providers to provide us with better networks. So all of that is government. Government has to come to the party and say, our future is digital education. We heard the president when he was talking early in the year, in the address, indicating that we are going digital in education. So we need a follow-up on that. We should not allow COVID-19 to derail that. Instead, we should allow it to fast-track it because it is shown us that we need that for the future.
Students say they prefer campus and not being away.
It is very difficult for us to study at home because some of us need to have contact classes so we can understand some of the topics very well.
Now that I'm back on campus, doing work is much easier. I'm able to do work up until the late hours of the night. I don't have to worry about whether I'm going to have enough data to do the work or not, when it's going to get depleted.
But Zanibe says they wouldn't mind being away so much if the tech tools being introduced currently are used as well when they have campus access.
Digital education is the future. I mean, if we do not do something now, we're going to continue to struggle. Already, we've got a lot of students that are not accepted in institutions because the space is, there's no space for them. So we have to start to think to say, how many problems other than the current problem are we solving with the digital?
Polity.org says without adequate internet access, students face exclusion from opportunities for learning, research and employment. Many university students did go back to campus thereafter, but things were not to be the same as time was constrained and universities had to still deal with COVID-19 and help stop the spread. It's not just university students that were struggling with their learning. There was also an issue in high schools. We went to Loskop, also in the rural areas of KwaZulu-Natal, where we met high school students who, because of a lack of access to tech tools, could not communicate or could not do their learning and could not even apply to university. They're also dealing with massive cultural practices that sometimes hinder their education. Temi Mdluli never finished school. She was abducted in the local practice of Ugutwala here in Loskop. She was later married off to her abductor, something she describes as the end of her life.
Lapha ko-10 thina sifikanga kwakuthiwa intombazane ifundela ukwenzani ngoba intombazane ifuna ukuyogana.
The principal of Mpumelelo High School says Uktwala is still practiced in the area and would like the community to learn about the importance of allowing girls to complete school and even do their further studies.
The kids of the school-going age, they get abducted by people from the community, and they say it's a tradition, but we don't know whether it's tradition or what, but they used to say that. And then afterwards they pay lobola, maybe 2 or 3 cows, and the kid or the girl just leaves the school.
Mdluli would like her granddaughter, Zesuliwe, to have a different life, one that she can enjoy. She doesn't have the means to ensure Zesuliwe applies to university, let alone studies at university.
Bengifisa ukuthi aye esikoleni esikhulu. Aphinde futhi afunde nakhona aqede ifiso zami lezo.
Zesuliwe says she once went to an internet cafe in town, but she struggled with her application process.
Ngake ngazama ukungena online ngithi ngi-apply kodwa khona izinto ezimbalwa zangihlula.
Then her teachers asked an organization called Do Me a Favor to visit the school and assist.
So we help students, specifically in the rural areas, to apply online. We bring what they don't have in terms of computers, laptops, printers, scanners, Wi-Fi, to help them apply for university applications. Any university applications in South Africa, and we help you to apply for NSFAS as well.
Their work assists with those who are on the struggling end of the digital divide.
It's a bigger gap than we thought it was. Number one, it's very far for the matriculants to access internet cafes in these remote areas of South Africa. Where students are able to access the internet cafes, they do not get the necessary assistance and support that they need at the actual internet cafe. And remember, we're talking about people that have never been privy to technology, that have never laid a hand on a laptop. Some of them have never even seen a PC with their own naked eyes.
Snenhlanhla Mazibuko is now at Wits University in Johannesburg. Despite his 6 distinctions in matric, he says if it wasn't for Do Me a Favor, he'd probably still be here in Loskop, not doing much with his life.
They have been a great deal of help. Bangisiza from process yokuthi ngikwazi uku-apply and stuff. I was students at the time, so bakwazi ukuthi bangichanelise through ama different channels ukuthi okay yini engingayenza ukuze ngisuke lapho. And futhi when I got to Johannesburg, they were able ukuthi bangwazi ukuthi bangilekelele with my registration ukuthi okay kufanele ngenze ini. As I was curious about technology, they even helped me ukuthi ngenze ezinye izinto e-university, which is actually like out of bounds for umsebenzi bona abawenzayo. With technology, we can have access to ukuthi, okay, you know ukuthi, okay, if you choose maybe a specific subject, like if you choose to do physical sciences and mathematics, ungazi ukuthi, okay, how the bunch of careers ungakwazi ukuthi uwenze e-university mawufika, uzofika lokho ukuthi uwenze kanjani lokho. And nakhona uthola ukuthi ulwazi khona uyanjani, uyasalela kulo. And mawufika emadolobheni nitsabona, usufika mhlambe e-university uthola mhlambe usukhethe mhlambe i-career mhlambe obungayithandi noma mhlambe obungamisele ngayo because awazi lutho ngayo. So uyikhethile thinking ukuthi ilento ebecabanga ukuthi but actually it's quite different.
Do Me a Favor visits a few schools in the Utukela district in KwaZulu-Natal. 2020 continued to be a very strange year for Zeketelo and other matric pupils who were in high school. Last year, we hope that their first year at university is going to be an easier one in 2021. All right, now you find that a lot of languages get lost because of migration and people sometimes forgetting their languages from home. But there are tech tools that help students or young people learn African languages.
Ambani is really a learning platform. We wanted to create resources for learning African culture and learning African languages, and it was also important for us to use technology as far as possible. So what we do really is that we support the education system, we support education through creating learning resources that use technology to make learning a more holistic experience for young learners. So right now we are focused on early childhood development. So our age group is anyone from the age of 3 to about 7 years old, and that's really the age bracket we're working with. A lot of our resources at the moment also support the existing education system. So we're looking at what kids are already learning at this age, and we're saying how can we support that or create resources that make that a little bit better. So you can download our free app. It's called Ambani. As soon as you get on it, you get to just click play, and then you can select the different languages you want to use. So once you have the set of cards, you can actually use them in different languages. So I'm going to select isiZulu for our example. We take the dog card, right? We've got our app that's open. And it's got access to our camera. So we basically place the card in front of us and then place the and then we place the actual camera in front of the cards, and the cards come to life. So it'll give you a sound, it'll tell you what the animal is, and you'll be able to hear and see and play around with the card. It's really a holistic way of learning versus just sort of reading or writing. So anyone who can't necessarily use all of those can use different senses to learn, which I think is an advantage of using technology for learning.
It is SABC Network on Facebook, Twitter, and Instagram. News Network at sabc.co.za on email. After the break, we find out about the launch of 5G in South Africa. It is SABC Network on Facebook, Twitter, and Instagram. Welcome back. Let's continue to look at 2020 in review. Now, COVID-19 mostly affected healthcare workers who had to deal with patients that were coming in. Many of them were infected with the disease, with some actually dying because of it. So telemedicine became popular, and it probably became a safer way for doctors and nurses to communicate with patients.
Because of the COVID-19 pandemic, some doctors were not seeing patients for some time. Hospitals also shut off from non-critical patients at some point. In Nigeria, some turned to telemedicine and drone deliveries of medical goods to online purchase of medicine.
During this birthday, when it all started and I needed to take my baby to the hospital, so I thought of it, would that be a better idea? Because I was actually scared to go to the clinic. So I made a call through and they gave me this alternative. Oh, you can actually consult with a doctor via telemedicine. I said, why not? So I tried it and since then I've never looked back.
In South Africa, taxi hailing services started delivering medicine to people's homes during the country's heavy lockdown. There are also methods to consult medical practitioners virtually here. Medivic is one such option.
Medivic is a newly developed, South African-developed telemedicine mobile application, which literally bridges the gap between a patient and a practitioner geographically, whereby we're addressing the need and of convenience of you having to go to the doctor, standing in long queues, and also addressing the need of doctors' scheduling capabilities.
Dr. Tlaleng Mofokeng is the United Nations Special Rapporteur on the Right to Health. She says the app is a great time saver.
There isn't a better time for these mobile health, digital interventions. I think besides just COVID-19 pandemic, making it, a bit scary for patients to go to the doctor's rooms or to the hospital, I think overall it will improve information. It will improve access to those patients who may be busy. We have to be honest that many of us don't have, as many 6 days as we would love. And so I think it just really brings another opportunity where patients can access services without delay and they can get credible information.
Users would have to divulge sensitive medical information when consulting on Medivic. Some have data security concerns about this, but the creators of the app say they took all the right precautions as expected by the Protection of Personal Information Act. There are also those that say such medical consultation methods are elitist because of high data costs in South Africa.
We've got challenges, in our medical health, and remember, there's also been the proposals and the delayed implementation of national health insurance. So basically, that gives you the challenge that we are facing as a country. And now, if you find these sophisticated solutions like this, which again, excluding the mainstream of appeal, it become a bit of a worry. But let's hope going forward, because as this is still a new thing that is starting, let's hope that going forward it will improve, because they indicated that they will be partnering with the major cellular networks in terms of extending this to the vast majority of the people.
But if you don't have these concerns, Medivic app is downloadable on both Android and iOS.
And you can bet that telemedicine will stay for a while to come, especially here in Africa, where some people can't even access healthcare professionals in the areas they live in. 5G also launched in South Africa in 2020. We found out about how it launched in Johannesburg and Cape Town and went to Howick as they were launching it there. We also found out it launched in Richards Bay, Pietermaritzburg, and Durban. 5G networks have caused a trade war between America and China. Huawei has been involved in the development of much of this network. Huawei is Chinese, and outgoing American President Donald Trump told the world that it can't be trusted. Those rolling out 5G in South Africa say they wouldn't put the well-being of South Africans in jeopardy.
We want to put technology that doesn't cause harm to our people, but enriches it. So we follow the guidelines of some of the international commissions on this. There's been lots of studies.
5G will enable fast upload and download speeds.
It's going to enable smart cities. It's going to enable better Internet of Things.
It provides very minimal, small latency and also massive throughput, which therefore allows for almost instant communication between things to things, right? So what that therefore translates to is that manufacturing, logistics, retails, the various industries are now able to utilize this technology to improve their efficiency, to improve how they do things.
We really believe that 5G is going to be the enabler to a lot of the challenges that we have to solve for tomorrow.
Vodacom's rival, MTN, launched the first phase of its 5G network in June. Last year, they tested things with Huawei at AfricaCom.
Now we know if we connect sensors in the robots, we can predict maintenance better. And if we can predict maintenance better in a manufacturing industry where efficiency is the main target, we drive the cost down. We save resources. You don't have to take half a day off to go and see the doctor. You can take a 15-minute consultation. The whole process becomes more efficient.
Vodacom has had a gradual process that started in Johannesburg and Cape Town. Their latest 5G deployment includes Howick, Pietermaritzburg, Richards Bay, and Durban, including the townships around the city like Umlazi and Ntuzuma.
Over 150 base stations at this point in time. And our intent is to now move or entrench it even further, to small towns, to rural areas, etc. And of course, taking the demand into account.
Take things to townships, take things to rural areas, ensure that all our people are saved. We must close this gap of knowledge and inequality.
In principle, there should not be any digital divide and there should not be any technology divide. So I believe that every country or every carrier, they need to think about best technology always. 4G, 5G are the best two technologies right now.
They're waiting for more spectrum to be auctioned before they continue.
When we talk about 5G spectrum for the C-band, 20 megahertz is not enough to be licensed to a carrier. So we suggest like at least 60 megahertz, for example, or 80 megahertz for each carrier to benefit from the technology. Also, the spectrum needs to be neutral in terms of technology, in terms of services, and that's how we can give the flexibility. Last thing, the government needs to incentivize operators for using higher efficient technology, like for example 4G and 5G, because this will benefit the overall country.
Vodacom says they used the temporary spectrum assigned by ICASA for this. As it launched in 2020, you can bet that we will be using 5G a bit more in 2021 and finding out what its benefits are. It is SABC Network on Facebook, Twitter, and Instagram News Network at sabc.co.za. On email, let's take a short break. We spend a lot of time on our smartphone, and we've heard that viruses can stay on those services for a very long time. So in order to be safer and to sort of reduce the spread of contracting COVID-19, we need to keep our phones clean a lot of the time. Here's how we can do that.
You wash your hands and brush your teeth, but are you cleaning the one thing that experts say carries the very most bacteria? You probably touched it today many times. How often do you clean your smartphone?
Okay, so let me be honest, I don't clean my phone as often enough. I feel throughout this coronavirus pandemic, I think that's when I actually, beefed up, cleaning my phone, but honestly, I don't see the need for cleaning my phone.
I don't clean my phone because I don't see any reason why should I clean my phone, because my phone is always clean.
And when was the last time you cleaned your phone?
I don't really remember when was the last time that I cleaned my phone. However, I think I done it about once today.
Dr. Matime Diale explains why you should be doing it often.
Cell phone has become part and parcel of our life. On a daily basis, if you don't touch our cell phone more than 4 to 10 times, it's something else that as much as we wash our hands, I think we should get into a habit of wiping just our cell phone as well. And remember with cell phone, as much as we say, advising our patient, don't touch your mouth, don't touch your nose, don't touch your eyes. Many times when you pick up a cell phone, if you don't have a handset, usually take it to your ear. And your ear is very close to your mouth. It's very close also to your eyes. We believe that in that could be one mode of transmission as well, that you can have any infectious disease, not necessarily COVID-19 as well.
Think about the surfaces you touch before touching that phone since the last time you washed your hands.
We do know that touching door handles, open up taps in public places as well, it's one mode of transmission of the virus as well. And also on the lift, it could be escalators going down. If you touch on the rubber bands outside there, many people have been there. We know that could be one form of mode of transmission of a virus or bacteria from a person to a person as well.
That includes in the bathroom.
I mean, we say now with a cell phone and entering into a bathroom, especially if you're using public utilities like in the malls. At home, it's much better because it can be controlled, because you know how often you clean your toilet or you clean your house. And at home, when you put your cell phone probably next on a table, on a coffee table, many times you find that at least once or twice a day, that table has been wiped off. The danger is that when you go to public places, you don't know the person that has been there before you. What happened, how much did you cough, and what did you cough out? Even if when you sit down, you wipe your seat to sit down, but your cell phone, if you can put it down or put it anywhere else, it's at a danger.
And hopefully, you wash your hands thoroughly after using that bathroom, because according to doctors, your smartphone can harbor bacteria and viruses.
You know, there are a lot of bacteria. You know, I'm thinking of bacteria that are more than 300, but one of the ones that we usually find around our cell phone, we call them streptococcus or staphylococcus. And sometimes you find them that in the household, we got a lot of fungi, which is part of the bacteria as well, that it can be easily transmitted from one place to another as well.
They say sharing is caring, but that shouldn't be the case when it comes to your smartphone.
I think it can, because remember with the selfie, you know, you usually go this, and you pass it on and you share in there. And also it could bordering on the issue of social distancing, how much distance you can have there. But I think it could be one of the things that we could minimize. The only thing that we can minimize is before you pass on your cell phone, maybe you wipe it off.
So cleaning phones daily at least is smart. And of course, make sure you frequently wash your hands.
And that's it. That's all we have for you. Find us on SABC Network on Facebook, Twitter, and Instagram. From me and the rest of the team, enjoy 2021. Good night.